The pandemic is also more widespread than it has been at any time before, with hospitalizations on the rise in nearly all 50 states. Carter Evans visited one small hospital in Rupert, Idaho, which is in a desperate situation.
With more people testing positive for the coronavirus every day, rural hospitals are struggling to keep up. We got a look inside Minidoka Memorial in southern Idaho, where they have 17 beds and room for only 3 COVID patients.
This is what we call the anteroom.
Nurse Melissa Bedke has already been helping transfer the most critically ill to other larger hospitals for months.
How soon do you think you'll have a COVID patient back in here?
We've only had a room open for like 12 hours at a time.
As many of those hospitals near capacity, she worries about what's coming.
Have you ever had to make a decision who gets care and who doesn't?
We've trained to things like that. And training's so different than when you actually get the real live body in here to figure out what to do. And we haven't.
This is one of the hospital's makeshift COVID rooms. You can see they've separated it out here with plastic, a window so nurses can see through. They've also reversed the air conditioning system so the air is sucked in and no virus can come out.
This 85-year-old man is infected and has been hospitalized here for 4 days.
Is he getting better?
He's pretty weak, and that's one of the common symptoms for a lot of people.
Kelsey Phillips and nurses at small hospitals around the country are working nonstop.
It's very tiring and exhausting. You're breathing the same air all day long.
And for them, concern about the virus doesn't end when their shift is over.
You got kids.
Mm-hmm.
You worry about bringing this home to them?
Sure I do. Yes, I have a son who has asthma. My husband and I both work here, so when we get home, we are stripping in the garage, throw our clothes into the washer on the way through. The kids have to stay in their room. It's changed the way we have to do things at home, not just at work.
Now, if the bigger hospitals reach capacity, one nurse told me they'd turn the entire medical floor into a COVID ward. That means they'd have to put other patients into surgical rooms, and when they fill up, the hallways. Gail, they hope it doesn't come to that.
Well, we all hope that. Thank you very much, Carter.